Before we take a hard look at the definition of food insecurity, I want you to think back with me to what it felt like in March and April of 2020 when there wasn't a roll of toilet paper to be found on the shelf at the grocery store. For some of us, like me, this pandemic might have been the first time we ever felt remotely panicked about getting sufficient food or toiletries for our families. But what if you felt that anxiety every single day? What if every month there came a point in time where your bank account was completely empty and you had no way or no idea where the next meal was going to come from? And what if you felt anxiety every single time you stood at the checkout line in the grocery store because you weren't sure if your EBT system would be working or whether you'd have to walk away empty-handed? Many of us can't grasp that innumerable moment when inconvenience and exhaustion and desperation that these food insecure people experience on a regular basis. Nonetheless, I hope we all can agree that mankind deserves to have access to healthy and nutritious food. So what is food insecurity, Karen, and how does it really differ from hunger? Well, your average dictionary, for those of us who recall using dictionaries in school, would define hunger as an urgent need for a food or a specific nutrient. In the food bank world, we think of hunger as a prolonged, involuntary lack of food. It goes beyond the usual sensation of an empty belly because it actually results in prolonged discomfort, illness, weakness, or pain. Hunger should certainly not be confused with my sudden craving for Cheetos while watching the Chiefs, but a deeper physiological need for nourishment. Now, food insecurity, on the other hand, is defined as the household's inability to provide enough food so that everyone in it has an active, healthy life. It's important to know that although hunger and food insecurity are certainly closely related, they are completely distinct concepts. Hunger refers to that personal physical sensation of discomfort, and food insecurity refers to the lack of available resources for the household to be able to afford food. So in the field of hunger relief, we really don't measure hunger, we measure food insecurity. So how do we do that? Well, it starts with looking at 10 distinguishing indicators of food insecurity. I'm not going to go through all 10 and bore you, but I will highlight a few of them. One of the factors is whether a household could not afford to buy a balanced meal. Another factor is whether a household has had to cut down the size of a meal, or maybe they've had to skip a meal in a particular day. Another factor is when a household reports having lost weight because they don't have enough money for food. And another hard-hitting fact is whether the household has ever gone an entire day in the last 3 months without eating. The general rule for food insecurity is that if a household reports 6 out of these 10 distinct traits, they're deemed to have low food security. These households not only routinely experience a reduced diet in terms of the quality, the quantity, and the variety of foods they eat, but also disrupted eating patterns. But what causes this food insecurity? As you're going to see, if you tour the gallery, these 12 stories highlight that there's not just one reason. At a macro level, it's easy to point fingers and say it all boils down to poverty. Although food insecurity is closely related to poverty, not all people who live below the poverty line experience food insecurity. In fact, there are significant portions of people that live above the poverty line and still face food insecurity. So when we peel back those layers and look at the individual stories in our community, we find that food insecurity doesn't exist in a vacuum. It's not a problem that can just be fixed by placing a grocery store in an underserved area. Rather, food insecurity is generally kind of the byproduct of other contributing factors that don't just overlap, they actually feed upon each other, no pun intended. Take, for instance, things like proximity, affordability, and even time. Any one of these could lead to food insecurity, but they often exist together. For example, when it comes to proximity, in the food relief world, we talk about food deserts. That's the fancy term that the USDA uses to refer to low-income areas where more than 1/3 of the population is over 1 mile away from a supermarket, a grocery store, or a farmer's market. We have food deserts here in Salina, but proximity can also mean there's a lack of transportation. It could also mean structural hurdles like lack of sidewalks, insufficient street lighting to be able to comfortably go to a grocery store that's down the road. That all can impact your access to food. Case in point, many researchers on the ground have noted that rates of food access and household dietary choices don't always improve when a supermarket is introduced to a food desert. In fact, some families actually travel farther away to a big box store where they can stretch their dollar rather than get their groceries from a neighborhood market. Across the US, studies show that groceries from neighborhood markets can cost anywhere between 3 and to 36% higher than the big box stores, which brings me to affordability. So even if the groceries are literally next door, are they affordable? We have to ask, does the closest food source accept SNAP or food stamps? It's important to remember that many families and individuals, even just falling on hard times temporarily, whether it be a week off of work or a steep medical bill, that can be just a tipping point for food insecurity. And for many others, it's a persistent battle. And when it comes right down to it, both budget constraints and food pricing can have a huge impact on the choices that people make, especially when there's healthier options that are more expensive and the opportunity to price compare is limited. It's not enough to mention the impact that general inflation can have on the topic. 82% of the households in Kansas that use food banks like ours report purchasing inexpensive, unhealthy food because they can't afford the healthier options. And then there's the whole time factor. Is there enough time in the day to prepare a healthy homemade meal? Does working unpredictable hours or multiple jobs stand in the way of making food choices? For those who are working multiple part-time jobs or overtime hours, getting food on the table often means relying upon convenient and affordable options. This is one of the many difficult choices those who experience underemployment or any other aggravating factor of food insecurity, they have to make. And it really just scratches the surface of the toll of time poverty, particularly for working parents or caregivers who juggle both long hours and childcare. So if things like time and affordability and proximity, among other factors, are so intertwined into the fabric of food insecurity, how can we ever solve hunger? For some of us, this saying may sound familiar. If the only tool you have is a hammer, you'll be tempted to treat everything as if it were a nail. In other words, society can't simply rely upon one tool, whether that be food stamps or food banks, to provide the solution. I believe it requires a multifaceted approach using a variety of disciplines and partnerships to chip away at the nutritional gaps that exist in our community. And the Salina Emergency Aid Food Bank certainly is a key player in that battle. And as I did promise to talk about how the food bank is leading the charge, I hope you don't mind if I take a few more minutes to brag about our agency and our vision for the future. Let me start with some really impressive statistics. 424,000 items were distributed over the course of 2020 to 5,974 households in Saline County. Now, you may be wondering, what counts as an item, Karen? Well, it could be as simple as a can of soup or a box of cereal, or it could be a 10-pound bag of frozen chicken thighs. And yes, you heard me correct. We serve nearly 6,000 households. That's roughly 9% of our county population. They sought food assistance from our agency last year. Although this stat is certainly record-breaking for us, there is still at least another 3% in our county that are food insecure and haven't utilized our services. Over the course of 2020, our agency also rescued 1 million pounds of product from local grocers and retailers. All of this product would have been wasted, ended up in a landfill, if not for the partnerships we have. And let me clarify, this product isn't necessarily expired or of low quality. It just might be overstocked or not to the standard that the retailer wants on display. Take, for instance, one of my favorite foods, pineapple. If the top of the pineapple isn't straight, it gets rejected. And if enough pineapples in an entire shipment are crooked, then the food bank ends up with pallets of pineapple to hand out to clients. Hence, food bank staff spend time every weekday making rounds to retailers to pick up product for a pantry. So who benefits the most from these products? Well, the typical image of the food bank client is usually the single mom trying to feed her kids. But did you know that our agency actually served 10% of our clients who were seniors over the age of 60? In fact, we distributed 904 senior commodity boxes last year. These monthly boxes provide seniors on fixed incomes with ingredients to supplement their diets, things like produce, juice, and cheese. Seniors aren't the only vulnerable population we serve. In fact, we delivered over 9,000 backpack for kids kits to local schools last year. See, when a teacher or a school counselor spots a kid who wouldn't have access to meals over the weekend, they can slip into the child's backpack a prepackaged kit with food items that child can consume over the weekend. Feeding America reports that 18.7% of the kids in Saline County live in food insecure households. As I mentioned earlier, our county had a food insecurity rate of 12.5% in 2018, and it jumped up to approximately 15.4% in 2020. Per Feeding America's research, only 42% of the food insecure population in our community is eligible for SNAP or food stamps. For those that do receive SNAP benefits, the nationwide average for a monthly benefit is only $129 per person. Now, if the average meal in Kansas is $2.89, and assuming that SNAP beneficiaries should eat 3 meals a day, just like I do, then the average monthly SNAP benefit will only purchase a Kansan 45 of the recommended 90 meals he or she needs in a month. And even if the SNAP benefits adequately filled the nutritional gap for those Kansans, remember that SNAP doesn't cover anything but food. It can't be used to purchase dish soap to clean the kitchen utensils or the dishes. It won't cover the toothpaste or the toothbrushes or the laundry soap, let alone the bar soap or the shampoo. That's why I'm proud of our pantry, because we make hygiene products a staple. Going back to those 424,000 items we distributed last year, you can see why it takes over 100 volunteer hours on top of our staff time each week to sort through the donations, to break down the laundry soap and dish soap into manageable portions, and to restock the pantry shelves. Between volunteers and service projects and community service workers, it took 6,217 volunteer hours to keep our pantry operating during the pandemic. For 2021, we project that the increased demand for our services will require even more donated time and talent, especially with the expansion and the renovation of the garden located east of our building. These gardens will hopefully bring together gardeners of all ages, backgrounds, and experience in a communal space where the joy of growing one's own food will be passed on. It's the food bank's mission, after all, that we provide for the emergency assistance where needed, but we also offer folks opportunities to improve their own food security. In the next couple of days, I highly encourage you to tour the gallery at the Arts Center. Take the time to view the beautiful handmade bowls, to take the time to read the stories of real clients like Carla and Barry. Through collecting and sharing these voices of hunger, we've tried to humanize the experience of food insecurity. I think you'll find that these stories have the potential to transform your own perception of food insecurity and motivate conversations about solutions to hunger. And of course, I would be remiss to say that anyone who is ever interested in touring the food bank or volunteering, feel free to contact me. All of my information is on our website, but please schedule a time to come and meet with me, as our lobby is closed due to the pandemic. Now, I'm happy to answer any questions you may have about the food bank or food insecurity.
Thank you, Karen. We do have a couple of questions that have come in. The first one is, how has the pandemic increased the levels of food security in general?
Sure. Well, the pandemic has really brought more people to the brink of poverty and really caused a lot more folks to come seek the assistance from food banks and pantries across the nation. Looking at some statistics, before the pandemic hit, it was about 13.7 million households that were deemed to be food insecure in the United States. And that number has jumped up. In fact, they're estimating that households with children, that number actually tripled because of the pandemic. That means on a local level, we saw an increase of 35% in the number of households that we served between 2019 and 2020. So that is thousands of product that left our pantry that historically wouldn't have left our pantry so quickly.
I noticed in several of the stories that your client shared with us that nutrition was such a key point to their overall health. And I think sometimes we forget about nutrition being that cornerstone to a healthy life. But there was someone who is in recovery from addiction who really had to make choices of keeping her body healthy or not. And nutrition was a big part of that. But then you also mentioned people that were choosing between medication costs or medical costs or food. Can you talk a little more about that?
Absolutely. These folks, these faces of hunger that we see on a daily basis, none of them look the same. You know, they come from all different walks of life. Some of them have medical issues that predate any concern about food that they may have. And then they have certain dietary restrictions. And then there's folks that, you know, having hunger is going to trigger a relapse into an addiction or resorting to a behavior pattern that's not healthy for them overall. So we do see folks that come to us with specific requests and are so grateful that our pantry is what we call a choice pantry. So instead of just making a pre-packaged box that's handed out to every single household that's asking for one, we go through a list of standard pantry staples, and they have the choice to pick. So if they have an aversion to anything that has tomatoes in it, we can cater to that. If they've already got a stockpile of canned vegetables, then they can say, no, I don't need canned vegetables this week. Instead, you know what, I'm a vegetarian and I need to have this kind of milk. We get all kinds of requests because that is enabling them to make healthier decisions rather than forcing upon them a product that they're not going to use or want to use, and that is also not going to be healthy for them. I had a client that had no teeth, and they specifically needed all soft foods. And we did our best to try to find as much soft foods as possible throughout the week from the donations. And we kind of stockpile then a stash for this one particular client because we know that that's going to make them feel like a person. After all, they're really not a charity case. They are a person, and they should walk away with the dignity and respect that is due them.
You talked a little bit about SNAP benefits, and is everybody who can taking advantage of using SNAP benefits? Do people know how to apply? And if they are using them, why does it not seem to be helping as many people as it should?
Sure. So SNAP benefits, just like any government program, does involve a lot of paperwork. It does involve navigating a system to make sure that you're getting what you need, and it does take time. So folks, one often in a traumatic experience or in a stressful situation, don't have it all together enough to get through the process to navigate that water and that paperwork. So SNAP benefits in our county, I think the latest statistics said that only 9% of our county actually uses SNAP benefits. And as I mentioned earlier, about 42% of the population that are food insecure are eligible, but there's a lot that even aren't eligible for SNAP. That I think the thing that people don't understand is SNAP is not going to cover everything that you want at the grocery store. It is for certain limited items, and it's hard when you're working multiple jobs and you can't take the time to bake your own chicken from scratch. You'd rather buy the rotisserie chicken and shred it up and put it in a bunch of different meals. Well, you can't get a rotisserie chicken with SNAP benefits. So there are some limitations. And so it is a tool that certainly helps folks overcome some of their food insecurity, but it by no means really solves the entire problem.
Another one of the stories I think really struck me as a mom, and as I dug in a little further and talking to some other people, there was a story that talked about just the ability to have little treats and to occasionally be able to pick up a cake mix for a child's birthday, at the food bank, and to have those little, I guess, wins, that dignity that they have, or that you may help them maintain by coming to the food bank and getting the help that they need, and not turning it into, like you said, not a charity case. These are human beings that need our help right now. And so I thought the little treats even was a nice story. It was a very human story.
Absolutely. We are so blessed by the retailers that help us keep the variety in our pantry, which does include a lot of pastries, which from a nutritional standpoint is probably not the greatest thing to always be handing out, but it does help when a kid's going to celebrate a birthday and they want to bring treats to school. Normal trip to the food bank wouldn't necessarily result in having an item that they could take to the school and feel just like every other kid in the classroom when it's their birthday. So we try to keep treats on hand, make sure we know if a client or any of their household members has a special occasion coming up. We're blessed with other retailers like Russell Stover's that, will give us some chocolate. And we're right now in the Valentine's season. So we're handing out big boxes of chocolate to clients because, it is Valentine's Day and they've got someone they love. And if, at the very least, they know that we love them and they will enjoy that. And it is something to brighten your day, especially when you've got so much other worries and stress going on. There's one story of a lady who's been on disability since she was a child. And with having to juggle the number of doctor appointments and medical concerns that she has day in and day out, it's a joy for her to be able to have cupcakes once in a while and to do something that's maybe not in your eyes or my eyes extravagant, but something that brings a little bit of pleasure that wouldn't normally happen in some of our clients' lives.
Okay, so one of our viewers says, I love the collaboration between the Art Center and the Emergency Aid Food Bank. Great project. Are there more collaborative projects planned? I think it's important that our viewers understand that this project came about through a great friend of the Art Center, Jim Vint, who comes to a lot of our Lunch and Learn events and just happened to say to me one day, have you done anything with the Emergency Aid Food Bank? Because he loves what we did with DACA. He loves what we've done to try to share information on the new jail and community justice. And so, we do try to bring attention to the topics that are relevant in our community. And we were just really excited about this opportunity with the food bank and that we were able to get it on our schedule and it worked out for the food bank and they were happy to have us. And so, as community members, when you have ideas for these types of projects and things that you would like the Art Center to pay attention to, don't be afraid to just call me up or stop in and talk about that, because we want to be as responsive to our community as we can.
I want to say thank you, Jim, because this was a fantastic idea. I know in collecting the stories and interviewing clients that several of them mentioned, I've never been to the Art Center. Like, this is going to be my first time or my first reason to go to the Art Center. And what an awesome thing for someone who hasn't had that experience to be able to see that their story comes alive in a different medium. So we're just thrilled that Misty reached out and we were able to make Jim's idea come alive.
So on that note, we want to encourage everybody to come into the Art Center. Admission is always free. And when you're here checking out the bowls and reading the stories, you can also check out a beautiful sunflower biennial, which is, I believe, just under 100 pieces from artists across the state of Kansas that are all under the age of 25. Some of you might have saw them. A few of them highlighted from Central High School that were able to get into the show. So it's a great exhibition to see. Come in and check out the bowls. When you visit, please bring a donation that we can give to the food bank. If you go to our website, you can read each of those stories. And in those stories, we've highlighted a particular product that person really enjoys getting from the food bank. So those are the things that we're trying to collect, everything from laundry soap to brownie mix. So it's all on there. We'll take anything. And if you're still not coming out to visit, please visit our online auction where we will auction these beautiful bowls created by 12 artists who donated them to us. I mean, we didn't commission them, so we want to definitely thank the artists that were involved and so willing to just give their talent and their work to us for this project. But you can actually purchase a bowl on our online auction. So you can see that link in the chat. Are there any last questions? I'm checking the chat boxes. All right, well, I hope we see you all very soon at the Art Center. We are open Wednesday through Sunday from 11 to 5. Again, admission is free, so please come down and spend some time with us. And thank you so much, Karen, for letting us be part of this project. Thank you to those clients who shared the stories. The stories are motivating. You have to come in and read them or read them online because it really helps you understand what this all means.
Absolutely. Well, thank you for letting us be a part of it.
All right. Thank you. Thank you, everyone, for attending.